everyone, I'm Dr. Addie Smith with the Northoaks Eye Care Clinic, and I'm here today to talk to you about something called viral conjunctivitis, or commonly known as pink eye. I know a lot of you are watching the live Facebook feed, so feel free to comment any questions you may have, and I'll do my very best to answer them during this video. So first of all, what is pink eye? Pink eye is a condition commonly known as, scientifically known as viral conjunctivitis, and it occurs in people of all ages. It's usually caused by the virus called adenovirus, which causes the common cold, but it can be caused by many other viruses. It can vary in severity, so it can be very, very light, or it can be very, very severe, where it's very painful, and patients come in thinking they have foreign bodies in their eye because it's so painful. The infection causes inflammation of the clear, thin covering of the white portion of the eye, and that thin, clear portion called the conjunctiva of underneath the lids. So what are some symptoms of pink eye? First of all, you're going to have swelling and redness of that clear portion of the eye. It kind of looks like there's fluid filled in between that clear portion and that white portion of the eye. You may have some watering. Patients are very confused because sometimes I diagnose them with pink eye and they say they don't have any itching. So itching is going to be caused more by allergies or an allergic red eye, not really viral pink eye. It's also going to sometimes cause some blurred vision. So in pink eye, your body says, hey, I need to fight this virus off. And so it sends white blood cells to the front surface of the eye, and they kind of get sticky. They kind of stick to the front surface. And one of the things we do when you treat pink eye or red eye is we try to keep those white blood cells from scarring. So when they come, they blur up the vision. They can even cause little open wounds on the front surface of the eye, which is why some patients think they have foreign bodies inside the eye. And by treating that, putting you on an anti-inflammatory, we can keep those little white blood cells from scarring and permanently affecting the vision. Like I said, it's commonly confused with different causes of red eye. So pink eye is actually just a category under red eye, but other causes of red eye could be bacterial infections, such as someone who's worn their contacts too long and has gotten a corneal ulcer, or patients who unfortunately get STDs inside their eyes. That can be a bacterial infection, or just common like Pseudomonas infections that can get inside the eye. I will say bacterial infections are more common in contact lens wearers and children. Most adults who don't wear contacts don't typically get bacterial infections. Allergens such as dust mites, just sitting under the AC, having it blow directly in your eye, or sitting in a very windy area, you can get a red eye just because of dryness. Chemicals, patients that work in plants and different things that get things into their eyes, that can cause a red eye. Pink eye caused by viral infection is definitely contagious. So the good news is, just by sitting in the room with me, you can't get pink eye. It has to be direct contact. By direct contact, I mean you're in Walmart and someone has pink eye, they touch their eye, they touch something, you come behind them, you touch it, you rub your eye, you've just inoculated yourself with pink eye. Another way to do it is just by having a common cold or a sore throat. So one of my first questions when patients come in with a red eye is, have you had an upper respiratory infection lately? So very commonly you'll get them after upper respiratory infections, you'll get them after the common cold, or like I said, a sore throat. One of the big important reasons that I do tell patients to come in when you have a red eye is, one, it could be pink eye, or it could be some of those other causes. But the big thing with viral infections is that they can get pretty nasty. So you can get something called a pseudomembrane that forms inside the eye, and it actually forms between the lid and that white portion of the eye, and it's something that sometimes we have to actually cut out. So it can cause scarring, where that lid is actually scarred to the white portion of the eye. Something else, like I mentioned earlier, those white blood cells, those can cause scarring. So it's definitely something you want to come in. It is treatable, but like with any virus, it's got to run its course. So it might be 7 to 14 days. By putting you on an eye drop, which is normally an anti-inflammatory, we are shortening the lifespan of that virus, but with anything, it's got to run its course. We're also very, very, very lessening the severity of it. So one of the things we also may do is put you on an antibiotic eye drop, and that's just to keep you from getting a little super infection. So some of these bacterial are very opportunistic. So you have a lightened immune system in the eye already, and so they're like, hey, this is a good area for me to grow. And so you'll grow a very severe bacterial infection. So a lot of times we'll put you on a combination drop, which is an antibiotic and an anti-inflammatory in the same bottle, just to keep you from getting that super infection. So basically, long story short, if you have a pink eye or a red eye, and you definitely should come into the doctor and get it checked out, it may be something as little as just some dry eyes that we can definitely start treatment for you so it doesn't get too severe. Or it could be something like pink eye or a bacterial infection or even like a metallic foreign body in the eye. So if you have any questions after this video, definitely don't hesitate to contact us. We'll try to get in touch with you and answer any of those questions you might have. Or you can call our office directly, and that's 230-EYES or 230-3937. Thank you guys so much.